Welcome. This is Bridges Muji Bakochola.
Prison quality human
as we build a sustainable environment for growth. The alarming incidence rates, staggering statistics, and high mortality associated with cervical cancer in Nigeria presents an urgent call for transformative action to ensure the safety and well-being of our cherished women and girls. The multidimensional impact of this disease on the health, social economic status, and mental resilience of Nigerian women highlights our shared responsibility as a society. It is with this profound understanding that PESN, an initiative aimed at uniting all stakeholders in national campaign against cervical cancer, came into being. And that's our focus on Bridges today. Why are we doing this? One, we are doing this because we happen to be part of the National Task Force on Cervical Cancer Elimination. The word is elimination. So here is a disease that can be eliminated if caught early. But today, we are not just going to be speaking ourselves. We have in the house a guru herself, globally renowned medical expert, the co-chair or vice chair of the National Task Force on Cervical Cancer Elimination. Most importantly, she's also the UICC President Global, a Nigerian, a woman, a mother, a friend, a sister. I can just go on and on about that. And you know her brand is Medicaid, but that's not where we're going. We're going to actually zero in on cervical cancer. Why cervical cancer? Why a national task force on cervical cancer? Your Excellency, Dr. Zainab Shinkafi Bagudu, you're welcome on Bridges.
Thank you
And
so
so
much.
today we'll try to build a bridge that will ensure the elimination. And that's why we had to move the studio from here and
Fantastic.
bring it to your office
Great.
so that you cannot escape us.
You're welcome.
Thank
You're
you so
welcome.
much. So we have this cervical cancer, and the task force at WHO recognizes that by 2030 we should at least have eliminated it to a considerable level where it will not be a public health concern that it is today. So how do we do this?
The million-dollar question. Thank you so much, Auntie Moji, for engaging me today and for the work that you're doing in the task force as well. As you mentioned, we're both partners, and the first step to elimination was the setting up, well, there have been different steps by the various health agencies in Nigeria. But when the Minister of State at the time, Dr. Tunji Alausa, decided to focus on it and set up a task force with the clear mandate of having a work plan to eliminate the cancer in Nigeria. We always say that we have the tools, which means we have the medicines, we have the vaccines, we have the treatment modalities to eliminate cervical cancer in the world. And this is why the DG of WHO set up a specific department and a call to action and an initiative to carry those 3 steps out. And the 3 steps are vaccination of girls aged between 9 and 14, and then screening at least once in a lifetime. All women above the age of 35 are supposed to be screened. And then early treatment, picking up the lesions on the cervix early and treating it. So how can we do it in Nigeria? The task force has the mandate to approach this issue And the first thing that we did is to set up this partnership, person. Person is a partnership of various stakeholders, because when we talk about cancer generally, people tend to lump it with the healthcare professionals. It's not just the prerogative or responsibility of the health sector. There are so many aspects that affect different parts of the society when you talk about cancer, and many of the community people are involved. So yes, we need money. So we need the financial institutions. We need to look at what we're eating. We need the nutritionists, the people. What food are we eating? What lifestyles, what aspects of our culture, what aspects of our religion is helping or creating a barrier to ending, to accessing these three pillars. So there are different sectors: the traditional rulers, the civil society organizations,
the religious
the
rulers,
patients themselves that have had it. So these are the people that have come together under the partnership. And one of the things that we did at the launch, which was very laudably led by the wife of the president, the first lady, Her Excellency Senator Oluremi Tinubu, one of the things that came up at that launch is the fact that a commitment is not just money. Yes, we need money. We need about $1.4 billion to eliminate cervical cancer in Nigeria. But we also need the commitment, the buy-in, the religious and traditional rulers to talk to their churches to say that take the vaccine. It's not going to harm your daughters or stop them from having babies. We need the Minister of Youth and all the sections in Women Affairs to involve the women groups and the youth.
So when we talk about this, when we talk about these pillars and the fact that it is doable if we have the, should I say, right environment, and of course we have all the tools that are needed. Now, let's look at people at the rural area. Are they going? How are you going to access them? Considering that even as we speak, our health sector still, has a lot of challenge in terms of access, in terms of demand, in terms of, creating the kind of awareness that would make them accept if it's available, but being able to reach them, particularly the people at the very, very lower level.
So that's where micro planning is really very important. We have champions. If you and I go and talk, yes, we might have our own clout, but the first lady of any country speaking carries a lot of clout, and her reach will be deep and wide. We have media partners, which you ably lead, and through that media, conventional and social media, we're able to filter down into populations. Working with the community gatekeepers, very important. We're working with the football coaches, with the traditional religious rulers, the ones that we know. They have a council that are always meeting. They work with the National Primary Healthcare Development Agencies. We actually have a good structure in place in Nigeria. Our 3-tiered health structure for health is enough to cater and able to cater to those rural areas that you speak about. The tertiary, secondary, and primary level of health is just to get the message clear, and most importantly, train the healthcare workers, especially at the primary healthcare level. We've had very successful vaccine rollouts, unable to meet the demand was unable to meet the availability of vaccines. It's far exceeded the availability. And sometimes that's why the partnership is good. We've been able to bring the governors. They don't even know. They don't know we're working in silos. They don't know that this elimination is possible.
Working in silos. And for these, it's about every woman, every girl.
Every woman counts.
Every woman counts. Every girl counts. Now, okay, sometimes we even overlook, the lack of awareness, even in the urban areas. I met somebody and I was speaking to her about, I saw her with 3 girls, and I asked, are these your daughters? And she said, yes. I said, how old are they? They were, of course, within the age 9 to 14 age range. So I said, have they taken HPV? Said, what is HPV? And my heart just broke.
Mhm.
I said, HPV. So we had to like sit together for her. So she now asked, where do I go
Exactly.
in the city
Exactly.
to ensure that my daughters are vaccinated?
So you see, we have to ask, how did the school system miss them? So these are girls in the urban areas, and I'm sure that they attend school. So in our own outreaches as well, we come across people in the rural areas that say that nobody talked to us about it. And then they will ask their daughters, yes, one auntie came and talked about it, but our teacher said we shouldn't have it. So we've just been discussing how to educate the healthcare workers and the teachers who are also role models for a lot of not just the girls, but their mothers, the families. So education and awareness is key.
Very.
Again, I go back to my statement. Cancer is not just for healthcare professionals. It's about the education sector. It's about who are we going to talk to, at which level, which of the teachers. The Minister of Education was at the launch, and she said, what can I do for you, and so on. I said, a lot. A lot. Just take responsibility for all the universities in Nigeria, all the women, and say that, let's screen them. Send that message. Fantastic. We'll be halfway there.
So, it all goes to the popular saying that prevention is better than cure. Let's look at treatment. Availability of treatment and cost. Does that worry you?
Oh, yes.
Is it a bridge we should be building?
Yes. Before we even come to treatment, we need to build the bridge on diagnosis. We're doing very well with vaccination. Nigeria has recorded a record over 13 million girls have received the vaccine, and we keep racking up the numbers. Just to put it in perspective, prior to the launch, prior to the rollout of HPV in Nigeria, across Africa, only 6 million had received the vaccine. Today, we have, just from Nigeria, over 13 million. So, however, that is good. That is ongoing. We're getting the vaccines in. There's availability of vaccines. The government is purchasing with support from partners like Gavi. But what about the diagnosis? How are we doing the HPV testing? The gold standard is HPV testing. That is not as widely deployed as it should be. And the affordability is an issue. And to me, that is where we need to focus on now, on screening and having easy to access and affordable platforms for testing. When we now talk about treatment. Treatment, of course, is facing the same challenges that most cancers are facing in Nigeria. We don't have enough equipment. We don't have a widespread comprehensive cancer centers. And they're not affordable to the ordinary Nigerians, even the ones that exist. A round of chemo is about 750,000 naira. How many people can afford that? You need about 6 per cycle, so it's a lot. And that's where insurance comes in. Health insurance, universal health coverage is something that the coordinating minister of health is working very hard on for cancer, for kidney disease, and cardiovascular disease with the National Sovereign Wealth Insurance, National NSIA, yes, insurance agency, and also the NHIE. So these are the two agencies that the coordinating minister is working with to ensure that we try at least to provide some basic funding, capitation for the ordinary Nigerians to be able to access. It's not just about the Cancer Health Fund. Yes, we have a Cancer Health Fund in place, but how much do they have, and how many Nigerians can we reach with that, with the numbers that exist?
Yes, and another thing that people have asked is, why cervical cancer?
Because we
why
can
the
kill
noise?
It. Because we can kill it. We can eliminate it. Simple. It's one that we have the tools to eliminate. So why don't we get rid of it? And it kills women. It kills a lot of women. And by eliminating cervical cancer, we can also touch on the other cancers that are caused by HPV virus. The main causative agent in cervical cancer is HPV, human papilloma virus. And it also causes some cancers. It's sexually transmitted. It causes of the mouth, anal, penile, and so on. So if we can really get rid of that, then why not?
Why not?
There's so many countries on
Yes.
the
Let
route
me
to
take
doing
you
it.
on the global scene, which you represent now, the UICC. Now, how would you foster collaboration? Because we are looking at partnership to
Mhm.
extend what we have now. How are you going to use this global office to, well,
Well, I think we're already doing that. The Union for International Cancer Control is an organization really that is very focused on looking at global initiatives such as the cervical cancer, such as childhood cancer initiative, and translating it into national action. So through the wide network of partners, over 170 countries belong to the UICC, and the organizations, we can help to build capacity. All the convening events are focused at that. We can help in training healthcare workers, and again to really engage the civil society organizations. They're often overlooked in terms of the value that they bring to the table and what they can achieve.
I agree with you.
So the UICC is very well positioned, working with the global bodies, all the donors and partners, and then having that network on ground in all these countries
I'll be able to
that can implement all the actions. So I really think that one of my goals coming from a low middle income country is to ensure that we increase access to the treatments that we have.
Yes, let's talk about the potential gains in, driving cervical cancer elimination. What are these gains? Maybe when people hear about them, then they will know that everybody, we're all stakeholders.
Well, of course, the first one is the obvious one, and the loss of lives that we are witnessing early. Women are dying from cervical cancer needlessly. Each year, on record, we have 12,000 women diagnosed in Nigeria with that's cervical cancer, and out of them, 8,000 die. And I assure you, Auntie, that we have a lot more that are in our villages, undocumented, undiagnosed, and untreated. So we know that the figures are much more than that. If you take a country the size of Brazil, their population is commensurate with that of Nigeria, equitable sort of, and they report 400,000 cases of cancer per year, new cases. Nigeria reports 120,000 cases.
Wow.
So where are the rest? This is a natural thing. We're not healthier than Brazilians in any way. In fact, half of Brazilians have Nigerian genetic makeup. So where are the rest? We're not recording them properly. Our registration system and health system generally is weak. So that is an obvious one. We will save lives. The economic benefits, when you lose a woman in a family, it breaks up the family, it breaks up the community. It has a profound effect on the life of the children. And cervical cancer creates orphanhood, and it creates financial toxicity and creates community disengagement in a way that we can avoid. If we have this one less cancer to worry about, and then we'll focus on the
other cancers. Yes. In speaking to this, I know that your clinic is very dedicated to what you do for cancer. Can you just give us a picture of a woman that is down with cancer?
It's not a pretty picture. Let me start with that. It's a situation that most of the cases that we see, they come in late stages. So if we were to go to, for instance, when we were in Kebbi and I was the first lady, any outreach we have, we could be having a lunch on, women empowerment, or even men. We could be having a political campaign. They will run to you with either a child or a woman with a fungating breast and so on. So where have they been? They've been sitting in the home and doing traditional. That is the picture that you see. Even sometimes at my gate, they turn up from Katsina and so on at the late stage. Yesterday morning, somebody sent a picture to my husband and he said, "How much did I send to them?" I said, "For what?" this woman is at the last stage of her life. Send her support to her family,
Mm.
maybe, but not for treatment.
Mm.
You know, you can
Not
only,
even palliative, what you call palliative.
yes, we can do that,
Mhm,
palliative
mhm.
and so on, and to ease her suffering. That is what we can do,
Mhm.
but make it very clear that is not for cure.
Mm.
You are just supporting them,
Mm.
and that is the case that we see 90%.
Sometimes, makes me very speechless, especially when all that, all the kind of economic barrier that is there, and people cannot really meet these treatment. So prevention, so partnership. So, Dr. Zainab, what would you be saying to our women? Let's address our women now. And of course, at some point, I would also want you to speak to the men, because it's a collective responsibility out there.
Absolutely.
Yeah.
Maybe I should start with the men. And we cannot do this without the buy-in of the males in our society. We exist in a patriarchal society, and most women are answerable to a husband, a father figure at least. And even it can even be worse in some areas and cultures where to access medical care, they need that permission. So we have to open up our minds. The men have to understand that it is fundamental human rights to seek treatment and to seek prevention and to go for regular checks. The same way we're asking for our women to be screened is the same way that we've been harping on the need to go for antenatal care so that we can reduce our enormous maternal mortality rates. And one of the good things about the programs that are in existence now is that we're able to combine them. A woman that is going for antenatal care can also have some form of screening, and she can be picked up early through those mechanisms. COVID showed us that partnerships work. And with involvement of all sectors, the private sector had a seat at the table, and we were able to deploy all the structures that are necessary. So we can do it with this cancer and the person partnership.
Yeah, partnership, very, very important. Now, message to the women.
And to the women, the first thing is to open up your minds and to understand that there's no hidden agenda here. We are just trying to make sure that what works reaches you in the rural areas and the urban areas. These are interventions that have been tried globally, and there's no hidden motive. We want to ensure that every Nigerian girl, woman has a chance and a future of living free from cervical cancer. So when they come to your area with the vaccine for your 9 to 14-year-old girls, allow them vaccinate your daughters. When they come and ask you, go for your screening or give you a stick, now we have self-sampling. You can take the self-sampling, go into a private area, take your sample, give it to them, follow up your results and see what is there. Early treatment is not a big deal. It's a day case. It's just a zap, zap, zap cryotherapy and you can go. It is so much more easier than the untold suffering and the hardship and all the things I've mentioned that can come with a diagnosis of cervical cancer.
Wow. That's really what we need, rounded up this edition of Bridges. What bridge did you think we have built today?
Well, I think most importantly, we've built a bridge of partnership, of reaching out and calling on members of our community to join the person partnership, and hope that my face as a trusted figure, I hope, in this space will encourage women and men to reach out and to do the right thing.
Yes, do the right thing. Build the very sustainable bridge that will eliminate cervical cancer in our society. The good news is that it is doable, but we must catch it in good time to get it all treated and for that sufferer to have a very, very good life. Now, as we go, we'll call on you to contribute in whatever form you can to ensure that together by 2030, if we still have life together, Even if we are not here, it will mean that Nigerian African woman, because they say when Nigeria gets it, Africa gets it. So I do hope that together we'll be able to build this sustainable bridge that will eliminate cervical cancers so that we can face other cancers, which include even children's cancer. And I will still come back here to discuss that with you. So let's walk away cancer. Together we can do it. And with PERSON and the National Task Force on Cervical Cancer Elimination would all do it together. Government, non-governmental organizations, you and you and you and you, all of us together can truly eliminate cervical cancer. So thanks for watching. Now be a champion, just like the First Lady of the Federal Republic of Nigeria, Her Excellency Senator Oluremi Tinubu, our main champion, has done. It is a collective call. Answer the call today. God bless you. See you again, same time next week. Thanks for watching.